never know how strong you are until strong is your only choice. Bob Marley. You never know how strong you are until strong is your only choice. Chemo is tough. I'm tired. I finished my last chemo yesterday. It's humbling. I want to thank the people, my friends, family. What? Oh, and my lovely wife. It doesn't stop. It doesn't stop. And students. And I thank you. I'm teaching now at Yeshiva University rabbinical students. And in all the years, and I've been teaching for 30 years, 35, whatever it is, years, high school, college, executives, I never had anyone praying. I mean, it really it's thank you. Thankful. And I want to thank Dr. Villar, who is my medical oncologist, Nurse Ann, with an R last name, Riccaboni or something. Wonderful coordinator. And the person who really took care of me was Nurse Rosemary from the Dominican Republic, 2 small daughters, just so sweet, because she's the one that gave me the chemo and my, what other shots that I take, my white blood cell shot, which I had today. And then I noticed this over here, and pretty soon I'll be needing, I guess, this. I'm taking Lupron shots every 3 months, and Lupron is a female hormone, so now I understand a little bit more. When Randy talks about hot flashes, then I start going through hot flashes, and I'll need one of these soon, I guess. So let me bring you back. 2002. May of 2002, my PSA was 4.2. As a white male, then anything over 4 was a red flag. I got a biopsy, and I was told I have prostate cancer. This is 2002. I went to Mount Sinai Hospital, same radiologist, Dr. Richard Stock, who treated Mayor Rudy Giuliani just 2 years earlier. I had seed implants, Mount Sinai Hospital, 2002. The brachytherapy seed implants. Let's fast forward to now. So in October of 2014, Dr. Ira Bright, my regular doctor, gave me a physical. Everything is good, but he calls and said, "Come in, I want to talk to you." So you know what that means. My PSA had gone very high. I want you to see our guy at NYU, and that's Christopher Kelly. I go to see Kelly. He says, "Okay, we're going to order a bone scan, a CAT scan, MRI, the whole deal." And I said, "Could you wait till January?" Because this was October, so, and my insurance was changing. You know, no problem. So in January, I do a bone scan, a CAT scan, an MRI, the whole deal. And I call him and I say, "Listen, I'm going to be 70 years old January 17th. It's not going to matter a day or two. Can we let me have a nice birthday party?" And then afterwards, call and do whatever. So afterwards, I come, 34th Street in Lex is where I go to the Perlmutter building. Yeah. And I go there, and Dr. Villar for the first time. This is February 5th. And he tells me, "Your PSA now is 3,416. You have prostate cancer that has metastasized to your bones." shows me, go ahead.
Love you.
Love you.
I'm proud of you.
Thank you. Arlene Polanski, all right. Woo! Grandma Arlene. So bad.
She's gonna love that.
You can hear me in the back, right? And you're picking up whatever feed, so I'm good. Okay, sorry. Yes, dear. So what, you asked, somebody asked, what's the secret? One of the things is, and I don't mean it in a pejorative, yes, dear. So where was I? I was at my most important thing in my life. I see this, he puts up this picture of you know, a male body. And along the spine, it's dark. Along the scapula between this shoulder and this shoulder, darken. Along the pelvic area, darken. My left femur, darken. And he goes, well, that's where you have prostate. So after I had an out-of-body experience of like, well, what just happened there? And Randy was there, Randy, my wife, for 31 years. Wow, and working together 22 years.
Together 37.
Okay. Thanks, Mike. Hey, I want to thank so many people here, people from NSA, National Speakers Association, Toastmasters International, Yeshiva University, and old friends that I have for many years. Many, many years.
At our wedding, yeah.
At our wedding. So, when Dr. Bilar told me all of this, then Nurse Ann is in the room and she's writing out all the scripts. I have to get prednisone, which is a steroid that you have to take 5 milligrams in the daytime, 5 at night. It's a speedy. My arms got bigger because you feel like you juiced up. You're like a baseball player, and it's got me speedy. And the first couple of days, I took it at 8 o'clock at night, and I couldn't sleep for the whole night. Then you have to take it at 5. So that, and then she gives me two scripts for nausea. If this doesn't work, take this. I forgot the names, but I got this. And I said, listen, Dr. Bilar, I've been smoking pot for 50 years. I'm going to use pot for my, nausea. And he goes, well, we don't have any studies done on that. And Dr. Ann goes, well, there's not enough studies, blah, 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 blah. Anyway, they order a CAT scan. And fortunately for me, I was unremarkable in 7 places in the CAT. I never thought in my life, I want to be so remarkable. Now, the greatest words I heard were, you're unremarkable in 7 places. Whoa, I want to fly under the radar from now on. Anything related to health, I want to be unremarkable, normal. I get over, great. So I must say, I have it now down as a kind of a science. I take my prednisone. I smoke my little bit of pot. And now I'm all programmed with this. Randy has great skin. And so since I had nothing, whatever, I started to use Noxzema. And then, Nivea. And then I got some Kiehl from somebody told me use Kiehl products. My skin has never looked better. Facial scrub is, really. So I have it programmed. Every time I take a prednisone, a little bit, I take one hit, then I do my facial, and it's great. I'm going to continue it without the prednisone.
No problem.
But we'll continue. So, let me.
So upset, it doesn't matter.
So, after my second chemo, my hair. I had great hair. Those that know me, right? Mike, stop. Great. Look, like lots of hair. Then it became reddish blonde, and then it became gray. But I had lots of hair, and it looked great. Yes. Yeah.
You had gorgeous. Anyone who wants to see it.
Okay, we can do that. So I always, when I'm out speaking, I always have my business cards in my left pocket. And to this day still, I have a little pen in my right pocket, and I just can't stop. I mean, I have my comb, because I still think that I have some of my Beanie Baby hair. Yeah, whatever it is. I didn't wear a hat today. I was going to, because I didn't want to mess my hair up. You know? So here's what's happened. So my hair is starting to come out. And Randy, my lovely wife over here, is one of these gloves, and then one of these rollers. Any place I said, I was like a golden retriever. I mean, really, it was just coming out all over. And she's there with this thing, and on my shoulders, and she got me a do-rag, and it's like, stop it already. So Randy's away one Saturday, and I call my foo-foo Tazal hairstylist with don't take any shoot over here, and Lucy is away. You know what? I gotta take control. So I go to Broadway and 90th, where we live, and there's Gabby's barbershop, a little baby guy from Russia, Gabby. He's doing something. I had to shave there twice. And he goes, well, Igor, we'll take care. So Igor is some guy from outside of Moscow. He speaks a little English. And we have the mirror here. I'm sitting there with my gray hair. And I say, buzz cut. And he goes, you sure? I said, listen, I have prostate cancer. And I said, boom. He goes, boom. And I start. This is like a cosmic joke. My whole life on this, and in 2 seconds it's over. And it's like, wow, I kind of like this look. It's like this Bruce Willis. Randy's calling me her Beanie Baby and stuff. So, I mean, what is it? You make lemonade or something like that. So, let me backtrack. Boom, boom. Oh, you want to know the secret of staying young?
Marijuana.
Yes? Well, little bodies, you know. But the secret of staying young, don't look in the mirror. Now, listen, one of the things that happens with kids, at least for me, is that I had edema, my legs swelled up. So Dr. Villar said, the only thing really is, the supports compression. It takes an hour to put them on. I mean, they're very comfortable once they're on, but I'll tell you, it's about even. It takes me a long time to put the socks on, but I don't have to do anything here. I'm shaving is once a month now, because he's not growing back at all. So, I mean, everything is a trade. So let me take you back. I told you about 2002, I'm diagnosed. 2002. 2008, 6 years later, we already did the high five for 5-year cancer-free, whoa, and feeling great. 2008, Dr. Bright, you're in great shape, but your PSA is really high. Go to see, and I was seeing, again, Dr. Hall at Mount Sinai, Simon Hall. He does a bone scan, a CAT scan, an MRI, the whole deal. And they find nothing. Cool. How come my PSA went up, doctor? We don't know. How come, and I was juicing at the time and eating wheatgrass, drinking, what's that, pomegranate, and it started going down. So he's lucky doing that. So that's 2008. Fast forward. 2012. 4 years later, everything is kosher, we're having fun, all is good. Viagra was working up until 2008. We had a good run, we really did, and then it got slower as, So 2008, now we're 2012. I go back to Dr. Simon Hall, chairperson, Mount Sinai. We do a bone scan, a CAT scan, this time a little different, a rectal probe, and something else with contrast, the whole deal. I see him. He finds nothing. This is 2012. So we had a run for a long time of we found it. When I saw Dr. Bright again, it was that early 2014, see, I want you to see my guy Kelly. And that started the whole process. So here I am today. My PSA, as I told you, was 3,416 on February the 5th. Yesterday I had it done, it was 30. So I'm in the right direction. And my hemoglobin, I forgot the number, but it's going up. I'm feeling, yet on Tuesday, which is 3 weeks after the key, I felt like me for a while. And now we're back to the same thing for about a week and a half. And then I'll feel my strength back again, and it's not over. I mean, mine isn't over. I'm still taking my, what's it called, Exgiva every month, and then I wasn't playing around. Every 3 months is taking a hormone shot. So, but I feel like me. So what will you ask other people? So let me just do it. Lessons learned. Well, lessons learned. The most important one, I'm very, very, very grateful for all the people in my life who show up. And I thank you. Be single lesson. Be here now. Right now. If I go over here in the past and, well, why me? How come? That's a total waste of time. And I did that for a while. That's a total waste of time for me now. If I go anywhere into the future, I go right down into a sinkhole, and then I often pile on. Mostly it starts with health, and then, but we have this bill, and then we have to borrow from there, and our work is coming in, until I'm like 15 with pimples. And if I'm with Randy and we're both in that place, and we're both 15 with pimples, we're in a lot of trouble. And that's happened at times. But it's like, come on back. Be here now. Take care of what you can take care of, Robert. Right now. Stay in the focus. Stay focused, Robert. Stay focused. And I've been able to do it pretty well. And I'm very proud of myself for that. I really am. Do I go off for a set? Yes, come on back. It's almost like a mental chiropractic adjustment. I mean it. It's just like, come on back. Deal with what you have to deal with, and health is the number one thing. Zero. Everything is health. So second thing, move a muscle, change a thought. Move a muscle, change a thought. Now, I'm a marathon runner. I climb mountains, scuba dive, but running was my thing, is my thing. I mean, I haven't run marathons in a while, but I know how to go to the gym. So I asked them at the gym from February 5th to Monday was the last day I went. How many days? And they gave me a printout. 64 days. Right. So my workout's not the same, but I still, this same rap that I'm having here, you could be on the bicycle next door, or you could be on the sit down, or we could be on elliptical, having the same conversation. Talk therapy has been great. I'm in a good place to be in therapy, I'll tell you that. I've never been so afraid in my life. Afraid for me. And, we have other stuff with Randy, with her Parkinson and her other situations. And I'm grateful. I'm more grateful than I've ever, I think ever.
Because your assumptions of life have changed.
I think somebody said priority. I mean, stuff changed. Cancer, like, I can't get my mind around. I could die from this. I've never been in any, from 2002, when I'm diagnosed, to this second, I'm in no pain. And I'm very fortunate and grateful. It's just like this, throw away all the bullshit, and let's get down to it. If you have your health, you have everything.
Right, true.
I mean, and put priorities in order. So for me, you got to be strong. You really have to be strong, and you have to be grateful. So what did I say that you said? You got it. Oh, you never never know how strong, I wanted to do it for you, because you never know how strong you are until strong is your only choice. You gotta be strong, and you have to be loving to those who love you. We still fight, but we get off it real fast.
Oh, no.
Wait, stop. We get off it. And grateful for good friends who were there for you, family, good friends. So that's my spin on all my children for the last 13 years. When you have your high five and you're celebrating 5 years cancer-free, I'm finished, bump in the road, all right. And then other stuff happens. But when he said, your PSA is 416, it was like I had an out-of-body experience. And I've had out-of-body experience, but not for a long, long time, but that was different drugs. But this was like, wow, did he really say that? And is this stick figure that's up there